Hey there, it's Corey with Ascend Smarter Intervention, and today I'm here to talk with you about writing. So writing can be a really challenging topic, both from the perspective of evaluation of writing skills to the teaching of writing skills. And so what we want to talk to you about today is really about how we conceptualize writing. So here to Send, if you know us at all, you know we absolutely love triangles and we absolutely love frameworks. So whenever we can, we try to put things into our triangle framework. And so for writing, what we're looking at is we're looking at three really distinct pieces or areas in which a student might struggle when they're looking at putting a piece of writing together. Now, when we're looking at writing in this way, we're really looking at writing at the connected text level, or writing a sentence, writing a paragraph, writing something a little bit more than just letters or spelling. Now, of course, when we look at writing as a whole, we always want to look at a student's ability to actually write letters, form the letters, and then spell letters. So at the sound and the letter level, as well as the word level. But this, of course, is going to be looking at what does it look like when we need to put all of it together. So the first thing that we always want to think about is a student's ability to use writing to demonstrate language or language knowledge. And what that means is it means that we need to have strong enough oral language. We need to be able to speak in a way that conveys meaning in order to be able to write in a way that conveys meaning. So when we're looking at structure here, we're looking really at two things, actually. So most importantly, the language structure. Can we put together a sentence that conveys what it is that we're trying to say? Do we recognize that usually we're going to follow a framework such as subject, a who or a what, followed by a predicate, did what, followed by some type of adverbial phrase. So why, when, how, where. And that's typically how we put sentences together. Now, of course, we can vary our sentence structure and we speak in different ways and we write in different ways, but generally speaking, we need to be able to follow a sentence structure that somebody can understand or glean meaning from what it is that we're writing. The other thing that we want to focus on when we're focusing on structure is actually just the fine motor structure of what our letters look like. So when we're looking at structure, we're looking at two things. One, most importantly, language structure. But two, are we able to actually put together a fine motor structure that somebody else is able to read? Because if somebody's not able to read it, then we're really struggling almost kind of more with this transcription piece. So that's the next piece that we want to look at, is the transcription and mechanics. So that's going to be things like our spelling, our grammar, our punctuation, usage that's really going to get us from understanding, okay, I understand what you were communicating, to I can read what it is that you are trying to communicate. So we need spelling that is strong enough that we can convey meaning, or that we can glean meaning as a reader. We also need to make sure that we have appropriate punctuation so that we're not changing the meaning of this structure of language by accidentally putting a comma in a wrong place that makes it mean something entirely different. Making sure that we have punctuation so we know where one idea stops and another starts. And that's going to really come down to the mechanics side. And then finally, we want to be looking at an ability to generate content and an ability to organize that content. So executive functioning is the ability to organize content in a way that somebody else will be able to follow. So essentially, we want to make sure that when we're writing, especially as we get into that paragraph level, that we're able to follow that sort of introduction, those key details, that conclusion framework, so that we can really get a clear picture of what the writer was intending to say. When we are evaluating for writing, we need to make sure that we're evaluating in all three areas, because we may have things such as dyslexia, we may have things such as dysgraphia, we may have things such as attention, all impacting writing. And so if we want to be able to tease apart how much might be related to an attention disorder versus how much might be related to a language, an underlying language disorder, how much might be related to dyslexia, and how much might be related to dysgraphia. Typically, what we would expect is if you have a student who has an oral language disorder, so something maybe like a mixed expressive receptive language disorder, or just a general disorder that's impacted language, we are going to see that here. So oral language difficulties may also, not may, very likely will also impact written language and the structure. So this can be an oral language disorder. This is typically something that's worked on with speech language pathologists, are often seeing this oral language disorder before it shows up as a writing issue. Then for students with dyslexia, oftentimes our students with dyslexia are really struggling right here. So dyslexia is typically known as a specific reading disorder. However, it also very much impacts writing, especially in this mechanics and transcription phase. So a lot of times they're going to struggle with spelling, they're going to struggle with grammar, capital, punctuation, all of that. When we have them with ADHD or attention disorder, it's often impacting their ability to organize their writing. So their writing might be all over the place, a little hard to follow. It may also impact mechanical transcription because they're just not totally paying attention, but that's typically going to be impacted the most here. When we're thinking about dysgraphia or a specific writing disorder, usually what we're looking for with our students is a student who's struggling in multiple of these areas. So at least 2, if not 3 of these areas that we're seeing difficulty in order to diagnose a student with dysgraphia or a specific writing disorder. The challenge is there's not a lot of writing assessments out there as it is right now. A lot of writing assessments, at least in the standard norm referenced world, are overinflating scores that look really high. You look at writing quality, it looks not so great. The scores are coming out like it's great. And so really what we need to do is we need to make sure that we're looking at all of these areas, not just from a standardized testing perspective, but also just from a qualitative perspective and making sure that we're looking at all 3 of these areas. Because writing difficulties can really be subsumed or kind of pulled into some of these other diagnoses, we want to make sure that if we're diagnosing some type of specific writing disorder, that it's not actually caused by one of these other pieces instead. So hopefully that helps, gives you a little bit better an idea of what dysgraphia looks like and what those writing struggles look like and how else it might actually be concise. If you have any questions, hesitate to let us know.